Hello, I hope you're having a good day. Today I'm going to talk about encephalopathy. So, encephalopathy refers to damage or disease caused by various reasons that affect the brain. So, encephalopathy is not a single disease, but it is a group of disorders which have several causes behind them. The causes range from being an infection to having a deficiency of some element in the body or brain. It is important to note the difference between encephalopathy and encephalitis, since the words sound very similar. In encephalitis, the brain itself gets swollen or inflamed and causes several symptoms in the person's body. However, in encephalopathy, the mental state can be altered because of several different types of health conditions. For example, hepatic encephalopathy occurs when the liver is unable to remove toxins as efficiently as they should. There are several symptoms of encephalopathy depending on its type, but the most common ones include confusion, memory loss, observable personality changes, and trouble thinking clearly or focusing. The type of encephalopathy I'm going to talk about today is Wernicke encephalopathy. It is an acute or short-term neurological disorder which is mainly caused by thiamine deficiency. Thiamine, also known as vitamin B1, is primarily caused with chronic alcoholism, along with other conditions like severe malnutrition and immunodeficiency syndromes. When alcohol is abused for a long time, the ability of the liver to absorb thiamine reduces with each progressive use. Wernicke encephalopathy mainly consists of a combination of these three clinical conditions. First, ophthalmoparesis with nystagmus. Second, ataxia. And third, confusion. Donato et al. Pointed out that they rarely occur together, which makes its diagnosis extremely difficult, especially when there is no history of alcohol abuse. These cases, which are caused because of a decrease in appetite and food intake due to depressive symptoms, showed that the most frequent symptom observed at the beginning of this disease was motor incoordination. The daily life of individuals suffering from this disorder is often affected because let's dig deeper into what these three clinical triads mainly mean. Ophthalmoplegia means paralysis of the eye muscles. People with this condition find it hard to focus their vision and their daily activities are compromised. It is difficult to maintain their gaze and perform other visual functions like depth perception, which is why they are more prone to falling or tripping, especially in uneven terrain. Ataxia is a condition with symptoms that mimic a drunk person. It includes slurred speech, stumbling and falling, deterioration of fine motor skills, gait abnormalities, tremors, and heart problems. Third, confusion, in this context, signifies a decline in the cognitive ability of a person. It takes away an individual's ability to think, learn, and understand. They're often disoriented and have trouble paying attention. With cognitive deficits like this, it becomes difficult for the individual to hold social relations. This often results in social isolation. I previously stated that this condition is common in individuals with a history of prolonged alcohol abuse. These individuals already have a disrupted socio-occupational functioning, and when they develop this kind of health condition, they become even more likely to develop mental health issues like anxiety, depression, and to some extent even psychosis. Well, I came across an interesting fact that another syndrome called Korsakoff syndrome is a neuropsychiatric disorder which also occurs due to deficiency of vitamin B1, thiamine. Patients with this condition suffer from dense anterograde amnesia and short-term memory loss. It is difficult to differentiate Korsakoff from other forms of dementia. So, when it occurs concurrently with Wernicke encephalopathy, it becomes Wernicke-Korsakoff syndrome. The most common treatment plan for Wernicke's encephalopathy is thiamine replacement therapy. The primary treatment for Wernicke encephalopathy is intravenous thiamine supplementation by administering relevant dosage for 5 days. This treatment aims to replenish the deficient thiamine levels and reverse the neurological symptoms. It is essential to start this treatment as early as possible. Another treatment which happens together with thiamine replacement therapy is that of rehabilitation and supportive therapy. In addition to this, individuals may benefit from rehabilitation, including physical and occupational therapy. Supportive therapy is directed towards the kind of symptom the patient suffered from. So, for example, in a patient who had ataxia, physical exercise and specific training on body awareness is introduced to help reduce balance problems and facilitate improvements in quality of life. Counseling and cognitive therapy can also help address the psychological and social challenges they face. The rationale behind these treatments is to address the underlying thiamine deficiency while also providing supportive care to introduce the individual's physical and cognitive function. Let's now talk about the long-term management of neurological disorders like this. So, long-term management can include dietary changes, follow-up care, and support groups. So, in case of dietary changes, for individuals with alcohol-related thiamine deficiency, long-term management often includes abstaining from alcohol and adopting a balanced diet to prevent future deficiencies. Follow-up care has regular medical follow-ups to monitor thiamine levels and assess the individual's neurological and cognitive status. So this helps ensure timely intervention in case of relapse. Support groups and psychosocial support includes joining support groups, which can be beneficial for individuals to share their experience and receive emotional support. Psychosocial interventions can help address the psychological aspects of the disorder and improve the individual's quality of life. I hope this video was informative and explanatory, and in case of any doubts, you can contact me later.